As of today, in this first week of July 2021, in spite of the availability of vaccines for COVID-19 in Canada, US, UK, Europe, and several other countries, people still have many questions. And still, there are considerable number of people who are reluctant to be vaccinated. Hi, people call me Vish. So let me wish you full protection against COVID. My friends and I have collected 11 common questions. I think you may want to continue to watch this video. So what are these 11 questions? First, what types of vaccines are available today, and specifically, what type of vaccines are available in Canada today? Second, are all these vaccines effective? If yes, to what degree? Why should I take any vaccine if I can still get COVID? And they still recommend wearing a mask after my 2 shots. 4, I have heard that these vaccines can have many bad side effects. What are these side effects? How common are they? 5, what about special personal health conditions and these vaccines? 6, these vaccines came out very fast. Have they cut many corners? If yes, is there some danger in getting vaccinated? 7, we hear of big variations in the interval between the 2 shots. What is the optimal interval? 8, why are there corona variants? Will the vaccine I take protect me against these new variants? Question 9. I had Pfizer as my first shot. They're offering me Moderna as my second shot. Is it safe to mix vaccines? Which vaccine is best for me? And the last question, number 11, how long will the vaccine immunity last for me? Will I require an annual booster shot? To get accurate answers, we're going to talk to Dr. W, as he is popularly called by his patients. Dr. W is a prominent cardiologist here in Toronto, as well as an expert in internal medicine. He has also produced a 4-minute short movie so that you can be at par and come up to the vaccination stage of our COVID-19 saga.
करो ना करो, सुनो मोर बात, न मिलाओ हाथ, हम जोड़त हाथ, न मिलाओ हाथ, हम जोड़त हाथ, न लगाओ मुख सो मैले हाथ, ना करो ना करो, सुनो मोरी बात, ना करो ना करो। मत डरो घर रहो कुछ दिन रात, मत डरो घर रहो कुछ दिन रात, करोना पे मिल करोना मात, करोना पे मिल करोना मात, जग कर निरोगी दीनानाथ, ना करो ना करो, सुन मोर बात, ना करो ना करो, गगम धनि रे सरे नि धनि, ना करो ना करो, गरे धनि रे धनि गम गगम ना करो। आनंद बरसाओ बरसाओ, आनंद बरसाओ बरसाओ, आनंद बरसाओ, बीस बीस दुख ना सताओ, उलझन सुलझाओ बिसराओ, नित सुख लाओ, आनंद बरसाओ बरसाओ, आनंद बरसाओ, तन मन में जो रोग लगा है, तन मन में जो रोग लगा है, तेज दवा दिलाओ, राह दिखलाओ ना तरसाओ, नौका पार कराओ, आनंद बरसाओ बरसाओ।
Dr. W, thank you for taking the time to talk to us. And thank you for offering to answer our questions related to COVID-19 vaccination. My first question is, what types of vaccines are available, and what type of vaccines are available specifically in Canada?
So you just now saw the movie which I created to bring you up in speed from the onset of pandemic to the present time, which is the post-vaccine era. The first vaccine was given around
18th of December 2020.
Canada, and almost 6 to 7 months have passed since the onset of vaccine. Before I go into the details of vaccine, the reason we decided to talk about these issues is with the advent of vaccine, or with the availability of vaccine, lot of questions surfaced. There was a lot of anxiety, a lot of worry about the vaccine, about the side effects of the vaccine, about the effectiveness of the vaccine, about the choice of vaccine, about different diseases which an individual suffered, whether he should take a vaccine or not, and that these uncertainties or these questions, when they were not answered properly, generated a lot of anxiety and then vaccine hesitancy. So we decided to address these issues and try to give you a collective information so that you have enough fund of information to make a informed decision regarding whether vaccine should be taken, why it should be taken, and whether we can help you in losing your vaccine hesitancy. So that is the whole purpose. Before I go into the vaccine itself, I would like to elaborate a little bit about how our body protects us from various infections. Our body is made up of a lot of cells, billions of cells. And these cells, one of the essential ingredient of these cell is a protein. It's made up of a lot of things, but protein is one of the integral part. And protein has got a property, this protein constituent has a property that it is antigenic. What do we mean by antigenic? It generates a response from our immune cells. These immune cells can recognize these proteins because of this characteristic of antigenicity. So our cells, our immune cells, which originally in our childhood reside in a gland called as thymus, majority of cells lie there, and these immune competent cells, which are called as T lymphocytes, then start gathering information about all these different cells and basically about the protein content of those cells, and marking these proteins which are present on these cells as self, because they were exposed to these proteins right from the time of our birth or even before that, and marked them as self, and also kept a catalog of all their characteristics so that in future they can recognize all these antigens, as we call, or the proteins which have this antigenicity as self, and thus acceptable, and thus good for us. If something else enters our body, our thymus cells or our T cells get this information that some intruder has come in, and they compare their notes, their records, and see whether these intruders, whatever has come in, does it have the same antigen markers as what they have recognized as self in the past. And if they see that it is not similar, or this is not they have encountered in the past, they immediately categorize that as foreign, thus not welcome. And what they do is they wake up the in charge of the arsenal factory, the B cells or the B lymphocytes, and they tell an intruder has come in, and they say that take care of this because I don't find them to be in my self-mark catalog. The B cell wake up and they start making certain chemicals, various kinds of chemicals, and these chemicals are nothing but antibodies. These chemicals are the antibodies. These chemicals are released into the blood, and these chemicals travel and go to the area where this intruder has come in. Either they attach themselves to this intruder cell and cause them to lyse or destroy it, or they make them sticky so they clump together and become non-functional, or if they can't do anything of that, they can't kill, they can neutralize, then they do is they mark them like a paintball which we play. And once they are marked, our patrolling cells, the WBCs and the macrophages, and they all can recognize this as an intruder because they have been marked by this paintball. I'm just exaggerating, uh, as non-self, and they launch their attack and take care of this. So this is how our body takes care of us whenever it sees an intruder coming in. And this is how the cell immunity helps us. These T helper cells are initially present in a gland which is called as thymus gland. And this gland has all these T lymphocytes sitting in it. And gradually, as our age increases, this thymus gland starts getting smaller and smaller. And actually, after age 1, there's a 3% shrinkage in the size of thymus gland every year, till by age of 65, 70, there's hardly any thymus gland left. Mostly it is fatty tissue. And all those memory T lymphocytes, the registrar, which keeps all this record, migrate everywhere else. They go and lodge themselves in the local lymph nodes, in the spleen, in the bone marrow. And from there, they continue functioning, monitoring, and recognizing whether the thing which has entered now is it self or not self, and whether it should be taken care of or whether it should be welcomed. So this is how the entire immunity process takes place. When we give somebody a vaccine, what exactly we are doing? The vaccine is nothing but we are giving the protein of that particular virus into we inject that into our body, and as soon as that new protein is injected, these T lymphocytes wake up and they look at it and they decide, oh, this doesn't look friendly, or this looks foreign, and they launch an immunological attack by the mechanism which I just explained you. So this is what that vaccine does. So after this basic understanding of what is immunology and how the vaccines work, we will go into the details of the questions.
So, your first question is what are the types of vaccines which are available? What these vaccines do is they basically, we know, we have just now learned about our immune system, how it reacts. So these viruses are also made up of this protein. And one of the protein which is present on the surface is called as spike protein. And this particular spike protein has been used and it is introduced into our body. It does not have any virus behind it, but just the spike protein. And various vehicles have been used to basically carry this with it into our system. One of the vehicle on which one vaccine is developed is a replication incompetent vector vaccine. There are two which belong to this category: AstraZeneca, which uses a weakened adenovirus which causes cold in chimpanzees, and Johnson & Johnson, named Janssen, which uses another kind of adenovirus. So basically, on this adenovirus, they attach a spike protein, and this spike protein and this adenovirus with the spike protein, they inject it into our deltoid muscle. And as soon as it's injected, our immune system, which we went into detail how it works, recognizes this as a foreign substance and starts making antibodies with the help of the B cells, which we talked about, and launches that immune attack. And after some time, that adenovirus which we have injected and that spike protein, everything gets destroyed, but that memory about that spike protein is still retained in our body. And when next time the virus comes in, we know how to deal with it. Second way of putting the same type of the virus protein in us is instead of putting the protein, they used what we call as a nucleic acid vaccine. The two vaccines which belong to the nucleic acid vaccine are Pfizer-BioNTech and Moderna. And both of these vaccines are mRNA-based vaccine. Basically, what it does is this mRNA is injected into your system, in your muscle. And that's where it has got a blueprint which teaches the local cells how to manufacture this spike protein. And once that spike protein is manufactured, our immune system kicks in, doesn't recognize it as self, and keeps a record of that. And then this messenger RNA, or that the blueprint which was introduced, is within few days destroyed, and the spike proteins which were also produced are also destroyed by proteolysis and by attack of this immunological cells. So basically, there is no trace left of the spike protein, nor there is that blueprint left, and all we are left is the memory. And next time we can tackle and deal with the real vaccine if it comes in. The third type of vaccine is, in this, the protein is injected in the form of the virus itself, but the virus has been weakened. So it is an inactivated whole coronavirus. And three vaccines belong to this category: Sinovac, Bharat Biotech, Wuhan Institute of Biological Products. And none of these are available here, so we will not go into the details of this. The fourth kind of vaccine is recombinant protein subunit vaccine, where they use nanoparticle and a lipid coat. This category of vaccine is Novavax. This is also not being used in this area, so I will not go delve into the details of it. And one interesting vaccine, which is a plant-based vaccine, and that is Medicago. It is in phase 3 of trial. About 30,000 people have been enrolled into this, and it is going to be manufactured in Canada if it is found to be successful. And this vaccine basically injects these things into a plant, and that plant starts manufacturing material which looks like spike protein. And then this spike protein which the plant has produced is injected into us. And now we are training our the immune cells to react to it and to keep that data available. So that is how these are the types of vaccine which we deal with. There are a lot of people from India interested in these, so I just gave the names of some vaccines which are available in India: Covaxin, Covishield, Sputnik. Just to name them, none of them are available here. The vaccines available, there are many other vaccines which are candidates for trial, which is Zycov-D by Zydus Cadila, by Biological E-collaboration with Dynavax, and the Baylor College of Medicine, Biological E developed by Johnson & Johnson, HGCO19, which is an RNA-based vaccine by Genova. There is a trial going on nasal vaccine by Bharat Biotech, and a second vaccine by Serum Institute of India and Novavax. we will concentrate on what is available in North America and in Canada. Initially, there was some AstraZeneca vaccines which were available, but now most of the vaccines which are available are two, which are Pfizer, BioNTech, and Moderna. And in Canada, Pfizer, BioNTech, and Moderna, that is what is available right now. Rest, they are not being utilized.
My next question is, are all these vaccines effective? If yes, to what degree?
Very important question is, I'm taking these vaccines. Are they effective? So here is the data which shows the effectiveness of the vaccine after the first dose and after the second dose. Usually, to have the full army of these T cells and everything, or to train all these T cells and the B cells and everything, it takes about 7 to 14 days after the second dose is completed. All these vaccines are very effective, as you can see. After the first dose, anywhere from 69 to 98% people do get protection from coronavirus in case of Pfizer BioNTech. And after the second dose, close to 90 to 98% get protection by the vaccination. But the Moderna has got similar 92% with one dose, varies between 69 to 99, and after second dose between 89 to 97, and the mean is about 94%. AstraZeneca is slightly less, is 76% after one dose, between 59 to 86, and 82%, that is 47 to 94 after the second dose. Now, what are these lower figures of 69 to 98 and 47 to 94? That is related to age. If you are 65 and younger, you fall more towards that 90 area. If you are older than 65 and more progressing towards 80s, the protection drops in the 60s area. So if you are elderly, you do not get as much as protection, but after second dose, 90 and 98, there is not much of a difference. It still protects you pretty well. So vaccines do protect you. So taking vaccine makes sense. This, what I talked about was the same thing. There was a public health study from England showed efficacy against symptomatic disease was only 57% over in the people over 80 years of age after a single dose, increasing to 85% after the second dose. The same thing was seen in the REACT study. The IgG positivity 21 days after one dose of Pfizer BioNTech was 80% of the adult under 60, but only 49% and 34% for above age 80 and above 70 and 80 respectively. So with age, there is diminished response.
Question 3. Why should I take any vaccine if I still can get COVID and they still recommend wearing a mask after 2 shots?
You have heard about that there are some cases reported of COVID after they were vaccinated. So what is the point in taking this vaccination? That was the question. The point in taking vaccination is this data will illustrate it very clearly. There have been total 154 million vaccinations given as per CDC report as of 28th of June, 2021, of which in the vaccinated people, only 4,686 got either required hospitalization or there was death reported, of which hospitalization was 4,427. So the death rate was only in 879. And of these 879 deaths, only 25% or 223 were not even considered related to COVID. Means they were admitted for, say, appendicitis or heart attack, and they died because of that, nothing to do with the COVID. And most of these people who were hospitalized, 940 of them had no symptoms of COVID. So out of the 4,427 hospitalizations, 1,240 or 28% were not even considered as COVID-related hospitalization. And out of the 879 deaths, 25% were asymptomatic or not related to COVID, or 25%. Very rare. The current data shows that the majority, 99.2% of the death as of very recent data, are only in unvaccinated people when they are getting COVID infection, and not in the vaccinated people. So please, the vaccination does protect you, and that does protect you very well. As you can see, out of 154 million people injected, only 4,686 required hospitalization or death was reported, and death was only about 879 out of so many million. So that is a very effective method of preventing. This is the data of Ontario, because being a Canadian, I'm a little biased. After the 9.4 million vaccinated, there were only 0.02% infections rate reported after the second dose was completed. And this, the detailed data goes after 14 days, how low is the infection rate amongst vaccinated. It is critical that you take the vaccine.
Question 4. I have heard that these vaccines can have many bad side effects. What are these side effects? How common are they?
Side effects of vaccine, a very valid question. Any medication which you take has side effects. If somebody tells you that I'm giving you a medicine which does not have any side effects, run away from him. So vaccine also being a medication, it also has side effects. The side effects, how bad are they? And what are they? Let's go over them a little bit more in depth. The main side effect, which practically everyone suffers to some extent, is the local side effect, which is pain at the injection site. And there is a specific side effect, which I will talk about in people who took a Moderna vaccine, which is called a Moderna arm. It will be discussed a little later. The other common side effect, which generally happens in a day or two and lasts for 2-3 days and then gradually disappears, is patient complaining of fatigue, sleepiness. Some people get generalized muscle ache or aching sensation in the group of muscle, headache. Some people have fever and can spike to 101, 102. I've seen it even personally. And most of these gradually dissipate within 2 to 3 days period, and there's nothing to be getting concerned about it. I will delve in detail about the allergic reaction and some unusual complications. So here it is, the Moderna, what it is. As I told you that you get local side effects of pain in the area where you had the injection, and the area in case of which happens on the same evening or by next day. But Moderna arm is usually it starts after 4 to 5 days of taking the vaccination, and the arm becomes swollen, heavy, it is red, and it is indurated. It means if you touch the skin there, the skin will appear thickened. So that is not uncommon to see this after the first injection. That does not contraindicate you from taking the second dose of Moderna. Sometimes I advise you to change your arm. If you have taken it in the left arm, take it in the right arm. You know that it is not an infection. You know that it is going to clear up within 7 to 8 days. And so don't try to rush and take steroids or antibiotics. Usually this is, if you have given Moderna vaccine, this is noted. And some people say that it is the response because of the robust immunity launched in that area. If it is really bothersome, you can put some cold compress and put some local topical steroid and some oral antihistaminic to ease your itchy sensation if you do have that. A true bill, allergic reaction. Allergic reaction to vaccine can happen, does happen. And the main concern of us is the anaphylactoid type or immediate type of reaction, which a small percentage of people can get. The instance reported is about 11.1 per cases per million dose of vaccination. It is much more common, or almost 80% of people give a previous history of similar type of reaction to something else. So they had anaphylactoid reaction in the past, and those are the people also are susceptible to get anaphylactoid reaction to the COVID vaccine. If you ever had the anaphylactoid type of reaction to a previous COVID vaccine, you should not take the second dose of the COVID vaccine. Or if you had an anaphylactoid type of reaction to some of the ingredient of the COVID vaccine, then also you should not be taking the second dose of COVID vaccine. Just to reiterate, Pfizer and AstraZeneca vaccines, they don't contain any human or animal products. There are no common allergens which we always hear about: latex, milk, lactose, gluten, egg, maize, corn, peanuts. So if you're allergic to peanut, that doesn't mean that you cannot take this vaccination. Everyone is told to wait for 10 to 15 minutes in the waiting room after given the vaccination to protect you from this anaphylactoid reaction. And some people may require EpiPen injection, but it's few and far apart, and that is the general precaution taken anyway. There are two specific things which are present in vaccines, which I wanted to point out to you. One is PEG, and second one is polysorbate. PEG is an ingredient in mRNA vaccine, and polysorbate is an ingredient in Johnson & Johnson vaccine. If you are allergic to PEG, you should not be given mRNA COVID vaccine, and ask for Johnson & Johnson vaccine by telling your caretaker. If you are allergic to polysorbate, you should not get Johnson & Johnson vaccine, and you should take probably one of the mRNA vaccine. Why I'm talking about these two things? These two things are common in many foods, many other medications added as a preservative. So if you are allergic to these things from the food sources and other sources of these two compounds, you may react when you are given these two vaccines, which contain, as I illustrated, one of them contains polysorbate, another one contains the PEG. This is a serious complication. Fortunately, very rare complication. This has been reported after AstraZeneca and after some Johnson & Johnson cases. Initially, there were very few number of cases reported. About out of 7 million vaccination done at that time with Johnson & Johnson, 6 cases were reported in the United States. Mostly these are females under the age of 60 and usually happens within 6 to 15 days after vaccination. Patient starts complaining of headache, blurry vision, speech problem, may have convulsions, may have reaction. So if you notice any of these symptoms within 6 to 15 days after taking these vaccinations, you should not ignore it. You should report it to your treating doctor so that it can be looked after. As I told you, the initial incidences were reported to be low, but the current incidence reported is about 1 in 100,000 cases. But one thing you have to remember, that if you do not take vaccine and you get COVID, there is close to 2 to 2.4% incidence of thrombosis, generalized thrombosis, or things of that nature, or even CVST syndrome happening in people who suffered from COVID infection. Compared to that, look at the number of people who get it from the vaccination, very, very low. We have been talking about this recently because it happens in young people. And recently, Pfizer-BioNTech vaccine was given clearance to be injected in children 12 and above. They and Moderna has also applied for licensing, emergency licensing for children under 12. But right now, it is under consideration. But with these injections, as of June 28, 2021, 780 cases have been reported, of which 518 cases were confirmed by CDC to be having pericarditis and myocarditis, and this happened after vaccination. Why it happens? There are a lot of theories behind it. It occurs in people younger than 30 years, and it happens with mRNA vaccine. The pericardium is the outer covering of the heart. It can get inflamed, or the muscle itself can get inflamed. Initial studies showed that after close to 3.6 million second doses administered to men between age 18 to 24, there were 233 cases reported of this, compared to 2 to 25, which would have been happening in this age group, irrespective of any vaccination or COVID or whatever. So it is about 12.6 cases of inflammation reported per million doses of vaccine. Most of these are self-limited. They don't even require treatment or hospitalization. Few patients required hospitalization and treatment with mild oral anti-inflammatory agent like ibuprofen or things of that nature. Overall, still, the risk-benefit ratio of giving a vaccine or withholding vaccine, it is safer to give vaccine rather than not to give vaccine, because most of these patients have a mild inflammation, and the same type of pericarditis or myocarditis has been also reported in COVID itself, and much more percentage compared to after vaccination. But you should know about it. And if your child starts complaining of sudden sharp chest pain or associated with breathing or coughing or palpitations, you should not just say that. You should not ignore it. You should report it to your family physician and get tested to make sure that this particular complication.
I suggest that you should tell your child not to exercise after taking vaccination for 7 to 8 days. because if the heart is inflamed, if he happens to be unlucky to have that complication, exercising during the inflamed state of the heart can cause problems.
Question 5. What about special personal health conditions and these vaccines?
The answer to your question of special patient group, there are three patients group which I would like to tackle. One is ladies who are pregnant or are breastfeeding, in patients who are immunocompromised or had organ transplant, and vaccinating children. Pregnant women and vaccine is, there's no question that pregnant women, if they do get COVID, all the complications of pregnancy are much more in these pregnant women if they get COVID. Hence, it is preferable to prevent COVID in pregnant women. There's no clear-cut contraindication noted or any unusual side effect noted of pregnant women being vaccinated. Most of the time, mRNA vaccines are being used on them. And if taken in third trimester, they may have an added advantage that they may even pass on some antibodies to their babies, to giving them some protection, as we cannot vaccinate them yet. Also, data which about vaccination, about 40,000 people, pregnant women were given vaccination, but only 4,000, close to 4,000 registered for reporting their problems after vaccination. And there was no significant complication which were reported in this 4,000 people who were brave enough and were interested enough to give the data back or participate in the study. There was more arm pain reported, but less fever and body ache reported. They are considered to be safe also for breastfeeding women. They may even protect the baby by transmitting the antibodies to the children, as it is concentrated in the breast milk. One can say, if suppose a pregnant woman says, I am following everything very strictly. There are no other children and adults which are coming and going out of my house. I can maintain my distance. I'm using mask, washing hand, and in other words, there is very, very low possibility of me getting exposed to COVID. In those circumstances, after discussion with her family or medical care provider, they can decide, they can defer taking the vaccine till the pregnancy is over, because they can avoid getting infected, and they are concerned about side effects of the vaccination. Children and COVID. In May of 2021, the American Association of Pediatrics reported just 1 year ago, the number of children who were getting COVID was around 3%. Now it has increased from 14 to 22%. So a significant amount of children are getting COVID infection, and naturally they are not vaccinated. High percentage of these children remain asymptomatic and less require hospitalization. And that is the reason, that is the argument people are making, that why even vaccinate them, because they don't get sick, they don't become symptomatic, they do not require hospitalization, death rate is very low. So why not? Why to take the chances of all to be heard about pericarditis and myocarditis and this and that? But they become, even if they are asymptomatic, they are a potent source of infection for their family members, their grandparents, if they go to school, to their school teachers, to their bus driver, and anyone and everyone else who comes into contact with them. So although they do not suffer, they are very efficient carriers of this infection and source of spreading the infection. So, and as the side effects, as I had already covered about pericarditis and myocarditis, is so low, the risk is so low that it makes sense to protect these children, which will make it even safer for them once the schools open. So vaccination is not a bad idea in children. Just to give you the data, here is the data of the upper one is the American data. About 14% of children are now reported to have COVID. And the Canadian data is between the age of 0 to 19, about 19% have been reported to have COVID. And this is true. This data just confirms what we know, that the hospitalization required for children between 0 to 19 is very low. It's about 1.8%. So very small percentage require hospitalization. But as I told you, they are a very efficient spreader of infection. The question of vaccination in the immunocompromised. All the societies, the rheumatic society, the musculoskeletal society, the heart transplant society, the kidney transplant, the liver transplant, all have said that vaccination is necessary in immunocompromised, because if they get COVID, they will not tolerate it well. It is also true that once the vaccine is given to these people, they do not launch a robust antibody formation. And sometimes it is said, or it is being discussed, that whether a third dose is better. But the question is, even if they do not get a robust 90% response, but even if they get 70-75% response, that still will give them some benefit. The person who is thinking of getting vaccination can talk it over with a caregiver, whether the dose of medication which he is taking, like for example, here I've given the rituximab, whether it can be withheld. So so you can take the vaccination. Vaccination should be given 4 weeks or more before your next rituximab dose is due.
One thing to remember is, if you are immunocompromised, you should not be getting injection of a live virus vaccine or even an attenuated virus vaccine. It can be risky, and your body may not be able to handle them.
Question 6. These vaccines came out very fast. Have they cut many corners? If yes, is there some danger in getting vaccinated?
There is that $1,000,000 question. Vaccine came so fast. We were all told that the vaccine takes years and years to develop. This came within 6 months to a year. Have they cut corners regarding the safety or the efficacy of vaccine because of the political pressures and many other pressures mounting and seeing what was happening in the community? Any vaccine trial or any drug trial, first is this is an animal trial, and then it's followed by a phase 1 trial in which they decide the plan, how many patients should be included, what age group should be included, what sex group should be included, etc., etc. Detailed planning is done, and after the detailed planning is done, then that planning is presented to some finance people, and then they put in the money and the trial is completed. And once that trial is completed, if the results are good, then the phase 2 trial planning is done, and then the money is collected. And the same thing happens with the phase 3. So each thing is done in serial. Once one phase is planned and the finance is done, phase is completed, then the second phase is planned, then the third, and so on and so forth. In present scenario, all the phases were planned simultaneously, and the finance was provided right at the beginning of during the planning phase, both by the government as well as private sector. So a big risk was taken from the financial point of view, not from the safety point of view, nor from the efficacy point of view. The risk taken of the financial point of view, that the whole project was financed even before they knew that whether this trial was going to give a positive result or a beneficial result or not. If that would not have not given that result, entire money would have been wasted. Not only that, the manufacturing was started even before the completion of the phase 3 trial. Normally, we never manufacture before until the phase 3 is completed and then excellent results are obtained. So all this expedited the speed at which the trials were completed. One thing also you should note that this RNA vaccine, this technology was there for 7, 8, 10 years before Corona came in. It was being used for flu virus, Zika virus, rabies virus, cytomegalovirus, and so on and so forth. So when the data came about the COVID-19 virus, all they had to do just use the knowledge they already had accumulated about the RNA vaccine. So they had a head start because they knew a lot of information about the RNA vaccine. Another thing which made this thing go fast was the plan was to conduct give the second dose after 3 weeks in one case and 4 weeks in another case, or 28 days in another case. That expedited the whole thing because there are a lot of vaccine where lot longer gaps are given between the first and second dose. Just to give you some example, Shingrix, the 2 doses, the gap between first and second dose is 2 to 6 months. Measles, first dose is given at 12 to 15 months, and the second dose at 18 months of age, and so on and so forth. So this, if they would have followed this methodology, each phase would have been, if they were going to give it after 2 months or 3 months, the phase would have been completed after 3 months. Instead, the entire phase trial was completed in 3 weeks or 4 weeks. So the whole 3 phases were condensed between 9 to 12 weeks rather than taking 9 to 12 months. So all these together made the appearance of or development of a new vaccine much faster.
We hear of big variations in the interval between the 2 shots. What is the optimal interval?
Now, question is, they have been talking about varying the length because all these studies were done in as I told you, 3 weeks and 4 weeks interval for this vaccine between the first dose and the second dose. Now they are talking about 3 months interval, 2 months interval, 4 months interval in Canada. Does that make sense? Well, it makes sense from 2 points of view. Major sense it makes is from the point of view of public safety and public health. Suppose we had limited supply of vaccine. So suppose you had 200 doses of vaccine and you decided to give complete protection to, it means 2 doses. you could have accommodated 100 people because 2 doses, 200 doses. So 2 doses is only 100 people getting it. And suppose it was giving 95% protection, even the best protection, we would have protected 95 people from getting COVID. Compared to that, you had 200 doses and you decided to give one injection instead of 2 injections, one injection. So you gave one injection to 200 people, of which only 75% got the protection, because majority of, unless you are very aged, you still get close to 75% protection anyway. So you protected total 75 after 100 dose and 75 after next 100 dose, so total 150. Instead of 95 people being protected in the first approach, that is giving 2 doses to everyone, if single dose was given to 200 people, you had protected 150 instead of protecting 95. So it made sense. And there has been some study which had a promising result that after the vaccination was given, it was a small study, but it showed that if the vaccination dose was delayed, Pfizer-BioNTech by 12 weeks, a British study showed that after 12 weeks, the peak antibody response was 3.5-fold higher compared to if they were given 3 weeks apart. So at least initial preliminary studies does not show that it is a bad idea. So for message from me is, if you are 70 and 80-year-old and you were given one vaccine and you were told that you have to wait 3 months, in my opinion, you should consider yourself, because you fall in the 60s range, 57, 60s range, if you're 75, 80 years old. You should consider yourself as if you're not vaccinated, and carry on as if you were not vaccinated, taking all the precautions which you needed. If you're very young, probably you still have 80-85% protection. You can take some liberty, but not. I will consider that you had one dose of vaccine. Consider yourself not protected. Once you have both doses, then you can consider that, yes, I'm vaccinated and I'm protected.
Question 8. Why are there corona variants? Will the vaccine I take protect me against these new variants?
Question about variants. And right now, everyone is talking about variants and all kinds of variants. Initially, the names were given on the basis of country from where they were first found. So they called it a UK variant, they called it South Africa variant, Brazil variant, India variant. And that started creating prejudices. People started looking strangely at people coming from these areas. So now they have given country-neutral names for variants. Alpha was substituted for UK variant, Beta for South Africa variant, Gamma for Brazilian variant, and Delta for India variant. Before that, these were the numbers which were the names given to the variant. I cannot even remember one of them. I've just given the names for you to know that this was what they were called before. Indian variant at present, they're called as Delta variant, has a B1.617 number given to it. So try to remember, it's easier to remember this alpha, beta, delta. Easier to remember. USA divided the corona variants into 3 types: variants of interest, variants of concern, variants of high consequence. Most of them were of variants of interest. Recently, the Delta variant has been has been considered to be a variant of concern. What is the meaning of all this? The meaning is that some of these variants, they spread a little more rapidly, and the antibody response to them is not as robust. but still it is robust enough from the vaccination which we get that you still are protected to a great extent. And this is what this slide basically shows, that the effectiveness of vaccine is 95% against the South Africa and the UK variant by Pfizer, and Moderna also similar, and Johnson & Johnson similar. Even against the Delta variant, although the antibody response was 6.8-fold less, but still the serum from these convalescent patients, if it was mixed with the virus was still neutralized quite well. So it still gives you a protection if you're vaccinated. And most of the disease now, which is happening, particularly in the United States, is in areas where Delta variant is spreading very rapidly, and is the main cause for infection, and is happening in unvaccinated people, not in the vaccinated people.
Question 9. I had Pfizer as my first shot. They're offering me Moderna as my second shot. Is it safe to mix vaccines?
Again, because of the supply problem, question came about mixing the vaccine. They have not noticed any problem in mixing the vaccine. There was some more side effects reported in one of the British studies. Feeling of feverishness was reported in close to 30% compared to 10%. So in general, the side effects by mixing was slightly more, but the effectiveness was not less. So there is no harm in mixing the vaccine.
Question 10. Which vaccine is best for me?
Which is the best vaccine for me? The best vaccine is the one which you are getting. So do not wait that this is better or that is better. If you're getting a vaccine, take it. It is much safer to be vaccinated than waiting for another brand. And at present, actually, there are only two brands which are offered in Canada, which is Moderna and Pfizer. Both have mRNA vaccine. So there's not much to differentiate between the two vaccines. This is an interesting question. How long I remain protected after I take the vaccine? Well, this is an interesting question. How long I remain protected after I take the vaccine? Well, so far the studies, the vaccine has been there for the last 6-7 months, and antibodies have still persisted to a good extent. It is a hypothetical question that will I have the same amount of antibodies remaining after a year? We don't know. So anything which I tell now will be a guesswork. And just come to think of it. You got a vaccine which generated that whole gamut of immune responses which I talked about. And that T cell woke up, and then they made that registry, and then they woke up the B cells and they started making these antibodies. And so we got a flood of antibodies in our body. After a few months, there's no more trace of the virus in our body, nor the spike protein which was injected. So do you think that this factory will keep on making those antibodies? No, because does it make sense? It will be waste of energy. So they will probably gradually slow down and shut down, and the antibodies level in your body will gradually start declining. But what about those Did we forget about our dear old faithful T cell lymphocytes and the memory B cells? They are still there. They are waiting behind the wings. And as soon as they encounter a next exposure to coronavirus, surely they will wake up. And that those B cell will wake up. The T cell will wake up. If the B cell did not wake up, the T cell will make sure that the B cell wake up and start making those antibodies back again. So just the level of antibodies coming down does not mean that your protection is gone. So you still, and most of the vaccines work in that way. They keep that in memory, and we may require a booster dose. So the question, there was another question, which was, will we require annual booster doses? What I see of the behavior of the coronavirus is they are not changing that fast. Whatever changes which are happening, whatever mutations which we are noticing are happening when there was rapid proliferation going on, rapid multiplication of this virus was going on, because too many people were getting infected in the community, and the virus had a very flourishing area to multiply and grow. That is when the danger of development of a variant becomes much more prominent. So if just like flu virus, that changes its nature or its appearance, even when there is no pandemic, or even when the disease is not present in the society in a rampant fashion. But coronavirus, the variants, in my opinion, started appearing because there were too many people getting infected, and there were too many people in which the virus was multiplying, and that gave it a chance to mutate while multiplying. That is when the thing is multiplying, that is when the mutation chances are high. So that is what I think. So I don't think that you are going to require very frequent booster doses or annual booster doses. But will we require one more booster dose, say 6 months down the line? Maybe, because there are already 6 or 7 variants which have already appeared. Vaccine makers, both Moderna and Pfizer, they are trying to mix all these different variants into one single vaccine and give us one dose, so that currently prevalent variants, we will get immunity against them, we'll get that memory against them. And in future, if the number of people in the community are not infected, so the virus is not multiplying that rapidly, chances of new variants developing will also start going down and will become less and less and less. So chances of recurrent every year booster at present does not seem to be the case, but only time will tell. This is a dynamic field. Things are changing. We are still learning about this virus, and things are changing rapidly. But at present, this is what I would say, that unlikely that you require booster every year. And I have also tried to answer the question about how long does the immunity last and what is the best vaccine for you. The vaccine which you are getting today is the best vaccine. Thank you. Okay, this is a condition. This is my bonus. It is not related to vaccine. It is a complication of COVID itself. A significant percentage of people suffer from the long-term effects of COVID-19. Why I decided to talk about it? Because it has become very prominent nowadays, and a lot of people are suffering from this disease. People get episode of COVID from which they recover. Many of them are not even symptomatic with their COVID infection. But after their recovery, they never feel well enough. This situation can last for several months and can be seen even in patients with very mild symptoms. And that becomes very important because, as I told you, children don't suffer from symptoms. But can they be affected by the long hauler syndrome? Yes, they can. So that is one good reason why you should protect them. There are many reasons given for that, but none of them is very well established. It could be that the viral reservoir in the tissue of the long haulers or viral ghost, or it has altered the immunity in some this way or that way. I will not delve into the etiology because we don't know. Basically, that is what at present we don't know. But it is true that they suffer from tiredness, fatigue, difficulty in concentrating, forgetfulness. They say that they have a kind of a brain fog. They get mild headaches, dizziness and standing, loss of smell and loss of taste, periodic episodes of palpitations, difficulty in breathing, shortness of breath, persistent cough, joint and muscle pain, body ache, depression, anxiety, difficulty in sleeping, or feeling drowsy all the time, a mild low-grade temperature, and symptomatology which gets worse after physical or mental activities. So in the beginning, people thought that it is all psychological, and it is depression or anxiety related to the COVID infection they had. But whatever it may be, whatever you want to call it, it is a true bill. People are suffering, reporting it. A lot of people are suffering it. It's similar to like what happens in the chronic fatigue syndrome. Initially, people made foo-foo about it. And usually, if somebody is complaining of these things, think about this and report it to your family doctor about this long hauler syndrome. It has been given a new name now, post acute COVID syndrome, and so if you are aware of it, you report it, and it requires a multidiscipline approach with a treatment from a psychiatrist, from a physiotherapist, from a respirologist, and so on and so forth. Exercises, respiratory exercises, other exercises, they all may help. So this is a syndrome which you should be aware of, and lot more people are complaining about it, and it's not all in your head. This was my bonus. It has nothing to do with the vaccination itself. And that, I think I have answered most of your question and also given you a bonus. Thank you very much.
One more thing which I wanted to end with this optimistic message. So do not forget to see the video at the end of this talk, where I have give you a message of optimism that once you are all vaccinated, including your grandchildren and children, you will be able to resume the activities with them, all the things which you did before. So a vaccine brings you a hope of resuming the normal life which you enjoyed, interacted with your children and grandchildren. So think about it. The big advantage which you are going to go with by getting vaccinated. Thank you.
Dr. W, thank you very much. You have answered all our questions in detail. I hope many of my reluctant friends will now get vaccinated quickly. Thank you.
Children, it is 6 o'clock. It is time to work. Work! Let us work!